colleagues, with great pleasure, I'd like to give you some resume. And right now, we have 3P medicine, and we listened to two presentations on 3P medicine and
в своем выступлении. Итак, мы будем говорить о предикторной, превентивной, персонализированной медицине.
So we'll speak about predictive preventive medicine for glaucoma, and here I would give three positions. Definitely, we have to speak about early identification of the disease, screening, and this is exactly what Dr. Chen was talking about. Also, we need to talk about the early detection of the progression of the disease. I would say even early identification of risks of progression at the onset of the progression of the disease. Then we need to speak about the selection of effective treatment and assessment of the efficacy of this treatment. And last but not least, about the algorithm of treatments and monitoring algorithms with well-known pathogenesis mechanisms of glaucoma optic neuropathy, keeping in mind individual biomarkers. And in my first presentation today, I would concentrate on first two positions and maybe which biomarkers can we use? These are routine methods of diagnosis, and we call them routine, and this is what we use in our practice. This is OCT, anterior segment OCT, SAP, but all that is made based on AI algorithms, and this is Professor Xiu and other colleagues who are talking about today. So this is extremely perspective, and it's interesting, and that was quite tempting to try to use particular biomarkers that we can analyze in laboratory, which is tear fluid analysis, blood analysis. So that's fast, but the question is whether it's reliable. The same story about immunological markers, and also it's very perspective to use genetic markers, although there is some skepsis around, and this is what something was presented in Professor Golubnitska's story. So early identification and prediction of progression based on deep learning and artificial intelligence. Now you understand that first and most important, this is analysis of fundus, and which is actively designed and implemented into practice. Also, it's perimetry and also coherent tomography, OCT. And I'm extremely happy that we enjoyed a fantastic presentation of Professor Xiu, because digital gonioscopy, well, that's extremely attractive, but only the first steps are made here. And last year, we heard a presentation of colleague Xan Sulan from China about the gonioscopy, about the search based on artificial intelligence. Limited experience, but perspectives are here. So how can we identify them in terms of switch to ophthalmic hypertension? Because we frequently see patients with increased pressure and we don't see any features of glaucoma. I remind you here that it was a very intensive study, which is ocular hypertension treatment study, which was prolonged for 13 years, and then 13 years later, they just analyzed in what percentage of the cases ocular hypertension switches to glaucoma, because we should not treat all the patients with ocular hypertension, but appeared to be that it is seen only in 19% of the patients, and in those where there's a switch from hypertension to glaucoma, the investigators analyzed 13 candidate genes, and they identified modifications, polymorphisms, and gene alleles, which are shown here, which was associated with this particular transformation of ophthalmic hypertension of glaucoma. So this is very important study that allows us to answer the question, who should be treated with ocular hypertension? Well, now fundus images are priorities for screening and early identification of glaucoma, and this is what we already heard about today. And well, statistical methods is getting improved and developed, evolutionized, and now we analyze such parameters like excavation, and also artificial intelligence could analyze even other moments that we don't pay attention to when we analyze fundus images. And it appears to be that this identification has very high sensitivity and specificity. At the same time, they analyzed images in multiple databases, 241,000. So they had educational models, testing models, and this is the high efficacy which was finally obtained. By now, we know that heat maps are actively used, and they allow to provide not only glaucoma screening using artificial intelligence, but also to identify the progression of the disease. And in fact, last year, Professor Faley spoke about it in detail, and in the top right corner, you see heat maps, and here we immediately understand if there is any worsening or progression, or if there is no. And similar maps are available for early identification of glaucoma. Mariatoni and the team offered to use artificial intelligence based on OCT, so looked at the optic disc and retina. So the model had very high specificity and sensitivity. And this model appeared to be much more precise, much better than the trend analysis that we use in our routine practice. And with the available OCT machines that we use for scanning. Now, perimetry. Well, perimetry was also used for deep learning and artificial intelligence, and specifically MD, which is perimeter parameter, was in the focus, and there was a sampling of 752 patients. The investigators designed the personalized prognosis of the changing of this index and progressing of the machine, and again, using machine learning, so-called Kalman filtering, they got personalized forecasts. Each patient is compared to population with particular disease. And finally, we can sum up that by now there are multiple attempts to use routine methods based on machine learning and artificial intelligence for the identification and the prediction of progression. Here you see some monographies were written artificial intelligence in glaucoma, but look at the diagram pie chart on the right. And mainly in all the models, we have the results of only one method of study. Most frequently it is fundus, then rare OCT, and some rare perimetry, and very rare, as I said, OCT data for the anterior chamber or the picture of the fundus. And unfortunately, multimodal approach is yet very limited, so just 13% of such studies using machine learning. And in our work that was just completed and submitted to the publication, so in our work we analyzed a lot of data on each patient. You see our main methods of examination. So here you can appreciate fundus photo, OCT, OCT angio, and also we analyzed beta zone square. So we looked at capillaries, SAP, bathymetry, we looked at ORA, so that's a sampling of 59 patients. We looked at membrane thickness, then we analyzed in detail thickness in different spots, and totally we got 40 parameters for each eye, and they were patients with newly diagnosed initial stage primary open-angle glaucoma, and the sampling is not very large, 59 patients, and we measured multiple parameters in each eye. We followed them for 3 years, and we split them into 3 groups with slow, moderate, and fast progressing rate based on the algorithms shown here on the slide. In our study, we used for the first time the so-called discriminant analysis based on the partial least square discriminant analysis. The method is called PLSDA, and this is deep learning method. And using this method, we managed to design a model that clearly splits the patients between those where the disease is expected as fast progressing, moderately progressing, or slow progressing. So you can see this clear split in between three groups. And in average, efficacy of the model appeared to be very high, 92%, because there was a high sensitivity and specificity. Also, the use of this model allowed us to identify the predictors of the disease progression. And on this diagram, we see most significant predictors shown here, and the red color are the ones which are extremely important to us clinically. And please appreciate here, so this is definitely thickness of the membrane of sclera. And here I would like to draw your attention to the laboratory potential biomarkers of glaucoma that already studied by now in this disease. And you can appreciate here that these are growth factors, transforming growth factors, cytokines, and brain-derived neutrophil factors. So all of them are important for the scleral membrane in glaucoma, because it is here where we appreciate glaucoma injury. And one of the best examples of the membrane damage is definitely excavation. And you can appreciate PECs, wide pigmented and irregular ASA, anterior chamber angle, and membrane becomes rigid. And this is pseudo-exfoliation, so it's very vulnerable and very sensitive to high ophthalmic tone and fluctuations of the intraocular pressure. So by now, we know biochemistry and pathophysiology of all these processes. We described collagen remodeling, ECM remodeling in LC. Also, it is proved that there is activation and high secretion of transforming growth factor beta, TGF beta, and reduced activity of MMPs, matrix metalloproteinases, or increased activity of its inhibitors, and all that leads to membrane remodeling. We have big reviews on how to treat membrane, scleral membrane. So this is remodeling of lamina cribrosa. So you see that was sort of a cross-linking, but all that was no effect. And what is most reliable is using prostaglandin analogs, because these are the treatments that we use in our daily practice, and we start glaucoma treatment with these analogs, so they can reduce the secretion of matrix metalloproteinases inhibitors and transforming growth factor beta. So first of all, these studies were done for latanoprost. So that was first prostaglandin analog that we saw in the market, and that effectively allows to treat glaucoma by now. And definitely here, I would like to remind you that this is GLAUCOMA and a fixed combination, which is latanoprost timolol as well as xalatan. And you see how ophthalmotone is reduced with a fixed dose combination. And if we appreciate the other results of our studies, so the next three columns mainly related to the circulation. Why? Because this is 3D, these are choriocapillaries. This is deterioration of the capillaries in the lower sphere or nasal, then also uh, loss of capillaries, and it is quite expected for many years. When we study the circulation, we continuously see how important are these parameters of eye microcirculation in glaucoma. And in this example, you can appreciate, so there is a high match between all these parameters. It could be the thickness of choroidea, which is right bottom choroidal thickness, or you see OCT angiodisc or temporal sector ophthalmic artery and reduced EDD and increased RI. So All these circulatory changes meet also structural deterioration and functional defects that could appreciate in some of these patients in physiological studies. So in this case, I'm happy to show you that glaucoma is progressing into advanced stage, and we cannot use coherent tomography for the assessment of this progression because we see effect of atrophy, so there is borderline excavation, progressive ischemia, so follow-up period of more than 9 years. But we see dramatically negative trend, and OCT angio gives us loss of capillaries. These are pictures on the right, and also you see paraphobia and trend analysis of vessel density with foveal and parafoveal, and this is low progression due to parametry data. And well, pressure, intraocular pressure is not very high, 20 millimeters, but for such stage and for such trend, this is very high ophthalmic tone, and we prescribe strong fixed combination of latanoprost and timolol. So this is example of positive dynamics. This is what we see in OCT angio in the left eye, again using Salaton. And please appreciate the density map, so fovea, paraphobia. So two pictures on top in dynamics, and again we see that clearly we visualize more vessels. Choroidea thickness, that's another important parameter, although not all the authors support the importance of the assessment of choroidea thickness in patients with glaucoma, and we mainly speak about the drop of choriocapillaries. But it was mentioned that in different glaucoma phenotypes, the thickness of parapapillary choroidea is very different, and it is especially reduced with so-called sclerotic phenotype, because we have sclerosis and atherosclerosis of the arteries and posterior arteries that feed the 3D structures, and that's reasonable. Many years ago, we found out in pseudo-exfoliative glaucoma, the thickness of choroidea in parapapillary and foveal area is lower versus primary open-angle glaucoma or in the control. So this drop-off of choriocapillaries that is reported by many authors, including us, is associated with other important predictor of the progression of the disease. And this is a red flag of progression. This is hemorrhagia on the optic disc. It is seen in the patients where we see the increased drop-off of choriocapillaries in this area. Also, this drop-off is associated with very dangerous effects in the visual fields, which are located close to the fixation center, and they reduce the quality of glaucoma patients' quality of life. Now we use OCT angio in AMPAS regimen, and we can measure the surface of choriocapillaries drop-off and also the surface of beta zone itself. So we see the increase of this drop-off from stage to stage. And also we can appreciate that even initial stage, at initial stage, this parameter allows to differentiate glaucoma patients from healthy volunteers. And pictures on the left are showing how we were assessing the drop of choriocapillaries, and we see the dynamics for several years. That's negative dynamics in the patients where we see drop of choriocapillaries. So the recent studies show that in terms of prognosis of glaucoma progression, vascular factors always play a very important role. This is a drop of paraphobia capillaries and also a reduced circulation in central artery and perfusion pressure reduction. So that is why now, for the treatment of such patients, we use classes of treatments with approved efficacy and safety, specifically kappa anhydrase inhibitors that are able to increase circulation, not only in the retina, but also in the vascular wall, and mainly we speak about dorzolamide. And let me show you this clinical example of the combined pathology. So here we can appreciate glaucoma then excavation and drusa and advanced glaucoma, choroidal thickness, thinning of the choroid, loss of vessel density in the peripheral zone, and deep capillary plexus. Because structures are very important, and we can appreciate here how capillaries are lost in parapapillary layer, which is shown on the right. So in this clinical case, dorzolamide is drug of choice. Let me remind you that original dorzolamide, it's a drozone, and also we remember about fixed combination dorzolamide with timolol, which is Karsop. And there were multiple studies that were proving that, yes, circulation is reduced in the patients, and it is improved with the use of fixed combination, both in the ophthalmic artery and in the posterior short ciliary arteries. Another case of focal ischemic glaucoma phenotype progression, you see again capillaries are lost in the posterior temporal sector. Look at the map of the density, and in the left bottom corner you see the loss of ganglios complex. Here you see trend is on the right, then slow progression of glaucoma according to perimetry data, but localization of these defects, they're very close to the center. That's why pressure 19 here is clearly high for these patients. That's why we prescribed fixed combination to get better reduction of ophthalmic tone. A very perspective here and very tempting is to use genetic studies in the concept of 3P-medicine for glaucoma. So this is early identification of the disease based on MEOS gene, also ability to genetically determine which eyes with ocular hypertension will progress into the primary open-angle glaucoma, then ability to genetically identify patients who are prone to progress, and finally to use genetic tests to identify the individual sensitivity of treatments. So in this study, and this is a big sampling of the patients, so there was a gene and polymorphism of this gene was associated with the fast progressing of the disease, so which was later on confirmed by perimetry data. It's interesting to use individual biomarkers to guide the algorithms for glaucoma treatments. This is something we were performed for patients with primary closed angle, and last year we reported the first results. And in fact, this is very important aspect because it allows to select correct treatment for the patients with closed angle. I'm not speaking about only glaucoma, colleagues, because we need to treat earlier at the stage of primary closure of the angle, and that's exactly what Professor Xiu was talking about. And here, based on machine learning, we offered formula where we measure parameters which are available. Specifically, we measure the gender of the patients, and then we use indexes and we measure IOP, AL, and ACD, and in this specific case, it could be iridotomy, maybe sufficient, maybe not, and also phocoemulsification of the transparent lens, I emphasize. Well, genetic studies are moving on to identify sensitivity to anti-glaucoma hypertensive treatments. For example, when patients may respond to timolol treatment, or would there be any adverse effect reaction or systemic effect for timolol drops. So all that could be easily identified genetically. And similarly here, the same studies were done for xalatan. Here you can appreciate individual biomarkers, and this is prostaglandin gene polymorphism identification, which is very perspective. And such studies were also carried out for glaucoma surgery, because a very important issue whether we have some scarring in the patients. So that can also be predicted based on genetic study using individual biomarkers, so important cytokine of IL-6. So it was offered to use targeted nanocomplexes of small interfering RNA to transport regulators of fibroblasts to prevent fibrosis after filtration surgery. So, colleagues, I would like to emphasize that the principles of 3P medicine for glaucoma involve the use of existing diagnostic methods based on deep learning methods and also on individual biomarkers for early detection of the disease, then for predicting the nature of the cause and choice of personalized therapy and evaluating of its effectiveness. So such systemic approach with proper set of individual biomarkers will improve definitely the quality of treatment and the quality of life of glaucoma patients. Thank you very much for your attention.